So basically, I'm doing this lecture for last about 15 years. And every year we modify, we bring more testimonials. We actually teaching more doctors. Actually, I'm comfortable most of you will do this injection. You need a little bit assurance to yourself. You feel good when you do it. Most of doctors, professionals, and nurse practitioner, physician assistants, we all feel good and satisfaction when we have result. You know, a result is when patient says, "Oh, you are a magician," and you feel like, "Oh, it's so good." Let's have a result. All right, so now this is disclosure. This is what I would like everybody will know. So, you know, a lot of time patients come to us, you know, and you take a look and they bring boxes of the tests, and they will say, "Doctor, I know I'm dying. I've done everything, all tests, and I went to so many doctors, and nobody could tell me what I'm dying from." And you say, "Oh my God," especially at the end of the day. So my lecture today would be a little bit short. I will tell you a little bit more of philosophy. I also would like to introduce in our workshop, we're going to have a Dr. Richard Hall who will help me to show how to do energy field, how to work with the energy field. You have to be very, very careful. Nothing stick to you. Because when you, end of the day, you could be physically tired or emotionally exhausted, but you never, ever lose yourself. You have to still be yourself, have a 5 minutes, you know, relaxation, or go to sauna for nirvana, or do some other stuff, but you still be yourself. This is how you continue enjoy life, and life will enjoy you as a professional, right? So I will ask you, please, certain slides available for everybody. Special videos, especially testimonials. Please do not do any pictures. No pictures of the slide and no pictures of the video. It's proprietary. It's trademark. Now, what Dmitry said before, first work on the stem cells was done in 1976 in a Kharkov Medical Academy in North Ukraine. And I was lucky, I met one of the doctors who was actually in a regional group which created technology to do stem cells, exosomes, and wharton jelly and all other tissue. And one of the tissues they had actually, they gave me the book, they use stem cells injection for treatment adenocarcinoma ovary. It's very interesting work, and it's right now out of print, and apparently they're not going to reprint this book. So if anybody see this thing, it would be very interesting. It's only about 50 pages, way how its technology was written and how it was suggested to use it. But anyhow, so it's just history. Now we're gonna have a certain syringes, and we have a certain needles. I make them available. So if most of anesthesiologists comfortable with them, but who are in general practice or not in a surgery, welcome to have it as a sample, so you could actually use it or order it in your supply house. So I have a book, so I have to, before I'm going to give a lecture, medical lecture, I have to do housekeeping work. So we're going to also show life-death point. SPG, it's not only one point. you have to always joint, or in TCM, it has been shown it always asymmetrical position from local injury or local symptoms or from the pain. So if somebody has pain right shoulders, you have to check left hip, or left hip pain, right shoulder, check it out. Right shoulder, we do know, usually related, it's what? It's to neck. Neck actually about 70–80% off if one of the shoulder is off. Now, how do I say this thing? It's like a rein on a horse. When you are on a horse, you move one side rein, it's actually neck start to move on the left side, right? So in order for you adjust it, you use both hands, and then horse will go straight forward. The same thing when we do SPG, it is Sphenopalatine Ganglion block. So what does it mean? It's an extension of trigeminal nerve. Trigeminal nerve, it's a point of the balance for sympathetic, parasympathetic nervous system. I don't use anymore word wellness. My old company partners in wellness, but I don't use it anymore. I usually ask people, patients, or friends, if they get involved with me on the medical side, I usually tell them, would you like to be in balance in your life or in your activity? It's a balance which gives us enjoyment. Now, next is I would like to introduce my partner in Kazakhstan, Dr. Alzhadz Jandosov. And next, it would be a couple slides before we go to SPG. Next, we're going to do a couple slides. Dr. Jandosov, it's very well-known, famous in Asia, and right now it's beyond Asia as surgeon, oncologist, and we did quite a few work together. And this is who is going to help us to do injection and to help to answer certain questions if you have about different other diseases.
Thank you so much for inviting me to be here. I'm so grateful, especially Dr. A.J. Farshan, and the use of his biologics, which have been very beneficial to our patients. Thank you.
Thank you. All right, now, I think I said everybody. I think this is now, we talk about patient came in the office. Okay. So she was very upset. She had presented with lymphoma. She's not able to close her arm, right? We put a paper to see, to show how big it is. It was bigger than grapefruit. After 2.5 work, you could actually see she closed her arm. So this is an exceptional situation. It doesn't happen every time, but we're going to show to you only exceptional situation. I really would like to, I brought this slide. This is September 8th. It's a fresh slide. Look at this. Many approved cancer drugs have clinical trial uncertainties, but they're going to be approved. I don't know how, what FDA think about it. I don't know how doctors are thinking about, but look at this. They don't want to put a real number, and I'll tell you a number, it's 80%. 80%, or approximately plus minus, 80% of drugs are approved, even it's not showing either improving quality of life when we improve extra, give a patient 3 or 6 months. It's unbelievable. So, you know, like many philosophers from the past, they say, long road, start with the first small step. So we all have to be somehow show our unsatisfaction with this type of things, and hopefully it's eventually we'll have more and more people that everything whatever up will go down and it will be improved. Okay, now we're gonna have the testimonial of the patient. So this patient who had lymphoma actually came in. Her liver was 4 times bigger by size, so it's actually almost going in the right groin. Her left side was full with a spleen 4 times in 2 years, 2.5 years. Okay, take a look. He cannot stand up. Look at this.
Cheers.
Look at this. Finally, he stand up, huh?
Now slowly sit down.
But he could sit down. He received 3 treatments.
Now stand up.
Look at this. And
Unbelievable, huh?
Yeah.
Next.
I haven't done that in years.
10 years he could not stand up from the chair. Not only that, he did not have balance. So we pay attention, he did not have balance. Not just because he could not step. He did not, it's like you have a pendulum. Why sometimes pendulum doesn't work? You cannot move your hand holding pendulum right to left. It's not gonna go. It's by gravity, we have to go one line, perpendicular to the land, to the earth. Now, let's go. Let's see.
I feel significantly
Take a
slimmer,
look on his
and my
hand.
extremities are much better as this watch was tight, and now I can put 2 fingers underneath it. My ankles and feet feel much better.
So 1 hour is for 1 day, 24 hours, he lost more than 10, 12 pounds. I didn't have to even measure. Okay? This was water. This was fluid. It was not fat. He lost it completely. He started to feel, he started to sleep.
This
He
bracelet
couldn't
used to
sleep
be
before.
soaked.
Look at this.
Both hands, and now he can do it all by himself, and there's plenty of room in it.
Right? This is what done with SPG. But SPG, it has to be, now if you take a look, you see, this is a Kennedy disease. And this is normal relaxation. This is one when he tried to squeeze his lips, okay, and he tried to move faster. Okay, but this is patient, this is a motor neuron disease. So they come up with work with Kennedy. Actually, after I look through this thing, we find out 10 years ago he had a sepsis. He had a 2 times clinical death, was resuscitated, and what happens, he had emboli. It's my suspicion in the brain where it get him in subnuclear place, and this is why he had those symptoms. Okay, next. This is okay. Now, this is what I would like to say. Why I try to tell you this thing? Any injury will bring internal organ problem. Please take a look. So we all have a 5 energies law, right? And in the past they call it fire, earth, metal, water, wood, right? Why is it? Because fire, what does it do? It creates earth. Earth create metal. Metal create water. Water create wood, and it comes back. So if there is a problem with the wood, which is what? It's a gallbladder, it's a liver. You have to always look on what? Patient will have either insults or stroke, or patient will have some problem with the pendulum, cannot keep a gravity, and so on and so forth. Now, next. This is in Russian because we had some Russian doctors, so I made for them. It's the same thing. It's also, it would show also for actually Chinese, it shows 5 times. We have a 4 seasons, Chinese had the 5 seasons. Okay, next. Okay, this one, how our emotions created, related to the organs. People who have a lot of what we say, oh, she's so hearty, she's so upbeat. I mean, she's like so much energy. And if you take a look, she has a jealousy. So you watch out, guys. Okay, next. Okay, now this is in a way we couldn't make it on this time on the slide. So we're supposed to live infinity. Okay? So why? Because if we take a look at pyramid, so pyramid, our pendulum, this is how it goes. In the moment this pendulum goes out of the base, pyramid ready to fall. Then it would be included movement on different side, most time asymmetrical. So if it's biochemistry, physiology, anatomy, this is, I forgot something else. So we have a 5 different system, and main system is here. This is our immune system, or it would be thymus. So most of time, when it's ready to fall, compensation mechanism is going to include, will be turned on, and then it will be turned on immune system. And this will tells us, are we going to survive? We're going to exist, or we have being. We enjoy life, and life enjoyed us. Now we talk about SPG. So we're going to go fast. SPG, it's extraoral. This is what we're going to teach. In extraoral through masseter muscle, I don't recommend you, because a lot of time fascia of masseter muscle get destroyed or get hurt, and it's for another 2-3 months, person will remember you with really bad connotation. And intraoral. Intraoral, you could ask every dentist, they learn this, it's inside. I'm going to show to you how to actually do it with your finger. Actually, I could show to you how you could do it with a Q-tip. In 1984, I was in the United States Army in New Jersey, New York Area Command, and I start to see my guys, after they have injury, they would go 5 o'clock in the morning, Upper East Manhattan, and what do they get? They get cocaine. And how much? Only get 3 to 5 milligram, which is 10 times less than real dose to have a high. And if you put this in the nose, upper nose, you could actually turn it on or off trigeminal nerve. Well, we're not using cocaine anymore. Actually, it was used also for children. Before any children medical center, usually they use the cocaine, put it on the skin to put it IV injection. And it's usually numb pretty good, local numbness. And then, anyhow, so we know we're not teaching this also anymore. But intraoral, I don't have, I have done intraoral, many of them, couple thousand. When I was in Moscow University in 70s, I didn't see so much fast response. Extraoral, through the temple muscle, you do it and you have result in 2-3 minutes. And also, I'm not sure why, it's actually improve your vision 20-30% for next couple weeks. Next. Okay, this one I will show to you. This is came from images from the Google. This is basically not real. This is trigeminal nerve, and this is a point we're supposed to, this is for ciliary block, but this is one, it's a palatine ganglion block. We could do those things through either injection up, or we could do through the temporal injection. So for hearing, we're going to show how to go here injection. But you have to be very careful because of jugular artery and vein. Okay, now when people have knockout, it's over here, and what it does, it will turn it off trigeminal nerve. So everybody who had knockout or severe concussion, you better give to them this SPG, and you would be surprised how fast they come back. Okay, next. Now, this is what everybody, especially radiologists, would like to see. This is the ganglion. Okay, it's from CAT scan. Okay, next. Okay, this is from Dr. Netter. I love him. I read his books, and I relearned medicine in America by using his book. But if you take a look, this is trigeminal nerve. This is not correct. This nerve has to be over here, because it doesn't show sphenopalatine, which is one of the most important button. You push this button and it will turn it off the trigeminal nerve. Next. Okay, it's the same thing, and if you take a look, you will see maxillary, it's a trigeminal, 1, 2, 3. So we're doing fast. Next. Okay, here I would like to show to you in the trigeminal, when we do SPG, many times we give injection over here. This is injection. It's between two occipital bones. This is injection. It's called death or life point. Okay, seriously, this is the way it was given by bamboo thorn injection, and person die. Not right away. Usually they bleed to death from the eye or from the ears, from everywhere. But this is will turn it off, as it shows all the system. Okay? So, but the same point, everything what is bad, it could be good. What is good could be negative for us. So we will show how to do together with the SPG to have results. Now, why it's so good? What is here? Anybody wants to say? This is the atlas. If atlas goes off, it's off. And multiple symptoms, and it's actually bad life. 5 minutes? Okay. 3, okay. So indication, next. Okay. How do you know, do we need to do it or not? You take this brush and put it up, all the way up, and touch this point. If this hurt, and if you have a toothbrush, put it finger. I will show it to you in a room. We will give you gloves, and you will put it in, and you will know. Then you would need this injection or not. Injection will come here. Next. Okay. Now, on a soft palate, anybody who does yoga, right? They know 1, 2, and 3 points. This point, it means dislocation of the atlas, right away. But this one, it's what is it? Right, it's a suture. This is a suture. If it hurts, you're not going to have a happy life. Okay, next. Okay. I brought it here. This is official. It's called what? Anterior ischemic optic attack. And it's treated only and only with SPG, then ciliary block. When surgeon does ciliary block, it's not going to work. It's already proven. The same thing like with EMD. I'm not sure why. We've done it, according to my nurse, I've done it more than 50,000 injections. Unless you do SPG, you're not going to have full long time result. So meanwhile, okay, now if you take a look.
Hello, my name's Kyle Davis. Just got a eye procedure. Still early, have to see the long-term effects, but yeah, it feels a lot softer to the touch. I don't feel the eye strain. I instantly saw a little bit of improvement with vision, and it does appear that there might be a little bit smaller pupil size. I still have to see it over time. It's only been like 5-10 minutes, but like, yeah, it does appear that there's at least some sort of improvement.
And this was after the eye doctors
Yes,
all told you there was nothing they could do for this.
100%. Yes. Yeah, I'd also like to add, like, there was a time when, like, literally earlier today, like, when I bend these toes on my right foot.
So basically, when he bent his toes, his eyes start to move and tremor and actually twinkle. Next. Okay, this is my friend, become friend. He is a Chinese fellow. He is right now financial genius, supposed to be. What happens, you see in the left arm? Well, all for 36 years, he wanted to drink bourbon, real bourbon, holding hand. He couldn't, because when he was 6 years old, he had a baseball injury, he had a trepanation. Yes, if it was a supraarachnoidal bleeding, and what happens is after that, half of the body was fully paralyzed. Now he is able to move. He is left-handed. He is holding his bourbon here. He could actually write and sign it checks and sign it letters with the left hand. He is happy. Why we started with SPG? Yes, we have to do this. There is a certain way you put technology with SPG. It would be in the next book, but we'll write it. But or if you come over, we will show this on a table. And last ones, can you do this? Yeah, and I have to show this. And so this is a ciliary block, retrobulbar, and peribulbar. This is a three different way how eye surgeons usually or anesthesiologists would define blocks. And thank you very much. And it was short, but
Thank you. Thank you.